okay, to start the discussion, have you had any skin problems?
I mean, for me personally, I don't generally, but then I suppose the one thing I do occasionally get is certain adhesives. I don't know if people find this with some of their base plates or flanges. I don't find it with them because I've got a system that works for me. But sometimes the flange extenders I use, I do get a rash, and it comes up really quite quickly. There's not the day-to-day silicone ones, they seem to work fine, but sometimes the adhesive creates sort of a rash and itchiness, and I can't really tolerate that too long because it then lasts for a few days. Maybe you can suggest what's the best thing for us to use if the skin is sort of inflamed or itchy like that.
Well, I first of all say stop using that particular flange extender, because obviously it doesn't suit your skin. And that's a very important point to make, that what suits one person doesn't suit another. And also over time, your skin can change. So you may have been using the same bag or flange extender or accessory for many years, and suddenly you get a reaction to it. And that's quite possible. We're very lucky that there's so many products out there that we can go to. Some areas it's slightly more difficult because you do have to go through your stoma nurse to change your prescription. And in Scotland, you can't request your own samples from companies. You have to ask your stoma nurse to do that. But in the rest of the UK, you can contact any of the manufacturing companies and ask for a sample. And that's a good way of trying things before you order full-size boxes.
Yeah, definitely. I think I use this product for when I'm swimming, because it does really well to keep the water out from getting under the flange, whereas the day-to-day ones don't do that so well. So I think I've got to the point where I tolerate it for a very short time for the sake of my training or for my swimming.
You could coat your skin with one of the skin barriers under that flange extender, a spray or a wipe. That might protect your skin for the short time that you're swimming, or a long time, because you do ultra swims, don't you?
I do long swims, yes. So, but people have mentioned calamine lotion and things like that. Are topical treatments like that good for our skin around stomas?
The good old calamine is a wonderful assistant, because it dries the skin and allows the bag to stick, and it's also very soothing. So if you have got any inflammation, it will calm it down, and it's one that you can buy in a chemist, so you don't need a prescription for it. Yeah.
Other products I've seen on the market are things like aloe vera and things like that. Is that like
you must be careful? Yes, you must be careful not to put anything greasy on the skin, because obviously that will prevent the bag from sticking.
Yes.
And I was going to go into how you clean your skin, not to use any harsh soaps or anything greasy, because you need the skin to be dry.
Yes. I wonder if anybody else in here has had any issues. If anybody's got an issue with skincare, maybe you can put the little hand up on your screen. At the bottom of the screen, you'll see a button that says reactions. And if you click on that, and you can choose a little waving hand. There we go. Anita, if you'd like to unmute. Hi.
Yeah, sounds like I've got something very similar to you, but I don't think it's caused by the glue. I've been using the same bags for a long time, well, a year now, but only just in the last month or so, it's been like intense itching all around the area that's covered by the base plate, I think you call it. And when I change my bag, it's red and a little bit sort of almost scabby, but not quite scabby, if you know what I mean. And I don't know if it's like an eczema or something like that, but my stoma nurses have sent me some vitamin E sachets, which I've been using for about 3 or 4 days now, and they do seem to be helping, but not getting rid of it totally.
I'll come in there a bit. It's possible that you've got some sort of infection under the flange. The flange is a very moist, warm environment, and you can get things like thrush, candida.
Yeah.
I would, if you can, I would ask your stoma nurse or your GP to take a wound swab of it and send it off for testing.
Yeah, I'm going to see them about it anyway, so I can ask them then. Yeah,
that's a possibility, or it may just be that an ingredient in the flange has changed by the manufacturer and you're sensitive to that one. I'm pleased to say that not many people are allergic in the true sense to any of the bags.
No, I don't think it's an allergy. Doesn't feel like one. I mean, I too go swimming, and I'm wondering if somehow the water's getting in there or something. Although I've not had a problem all year, so I don't know why that would happen.
It's probably best to see your own stoma nurse if you can.
I will
because
do that.
They know you, and they can, you know, suggest the correct thing for you.
Okay, thanks for your help.
Welcome. Maureen, you have your hand up. Do you have something you wanted to add to the conversation there? You're muted at the moment, Maureen, if you wanted to say. I think she may.
Sorry.
That's okay. Good to see you.
I've been very lucky and had very few problems with my skin until this probably last year or so, and it doesn't itch and it doesn't bother me, but it's like, you know, where the flange and it can just where your creases are in your skin, and so it goes a bit wavy like that. I've noticed now that I've got like raised skin that does almost look as if it's got a bit of a scab on the top of it. Now, I've never used a adhesive remover. I've had my stoma for 25 years until I noticed this. So I have now started using an adhesive remover, but I think I'm still left with these ridges, and I just wondered if anybody knew what they were or if it's anything to be bothered about.
I find personally that's why I wear extenders, because I found, I'll use the example of swimming particularly, but when there's moisture around the edge of the flange on my skin, it would wrinkle up sometimes, either when it's wet or just from wear and tear. But yes, I completely understand that wrinkling around your skin. And I put the flange extenders, I use silicone ones, over the edges, and that prevents it catching or wrinkling up. So that's how I got around that problem with it. It was just the dryness, I think, of the edge of the flange on my skin that just wrinkled up. So my own personal solution was to try a flange extenders just to cover those edges up, and then I didn't have a problem anymore.
Yeah, I must say I've got like one at the bottom of the flange that's like a little arch, and then the others are on my right hand side, and it's just like three lines where the skin where the flange just tends to
pinches it in a way, doesn't it?
Yeah, it just moves a bit on the, I mean, it just feels as if it's stuck, but you are right that it does tend to be on the it is on the edges, so it might be worth trying an extender.
Yeah.
Right, I think you can see me now.
We can.
And hear me.
Yes.
So I'm going to try and share my screen so that you can see the hints that I've put for this talk. So let's see.
Right. If everybody else could mute, then now we'll hear Carol.
I can't mute. I can't share my screen, so that's not going to work. So carry on talking amongst yourselves. I was going to try and get you all to elicit the possible causes for skin problems. Obviously, we've had leakage as one of the main causes. And have any of you had bad experiences with leakage?
Mine just depends on what I've eaten, I suppose. Some days I have a good day, some days I have a bad day.
I had quite a lot of leakage in the early days when I was trying lots of different types of bags that the stoma nurses gave me to see how I got on, and absolute disasters sometimes, like 3 or 4 changes a day. And then they decided to give me the what do they call it? It's like a sort of raised ring. Convex, that's the ones, yes. Sorry, I'm not very good on all the terminology that I hear bandied around. Yes, so they're convex ones I'm using now, and I haven't had a single leak since, and that's, well, probably 10 months or so. So I don't think
yeah, it may be that you'd had a little crease or a little bump or something that where the flat flange wasn't sticking properly. So the convex ones, if you find them comfortable enough, are really good at stopping leakage. They're not quite as flexible. Yeah. Oh, good. And obviously products are improving all the time. We're so lucky here, aren't we? So yes, I do. But you do need to see a stoma nurse before you can go on to a convex product, because it needs to be assessed and considered right for you.
My problem, you can't see me. I don't know if you can hear me.
We can hear you, Anne. Yes.
When I've had my stoma now 50 years, but for a lot of the time I suffered from itching under the flange, and around the stoma, and all it was, well, it seems all it was the soap I used. It was perfumed, so I use simple soap, or sometimes I use a dermal soap substitute. And that is perfect. I've not had any now for a long time. So that's a really simple thing to do if you suffer from, it might not be everybody's cure, but it was my cure.
Yeah, we don't usually recommend using soap. Normally warm water and a wipe is enough to clean your skin. But if you find a soap that suits you and you like it, that's absolutely fine. But perfumed soaps, are not good. Nor are baby wipes. Some people think it's simple to just take a baby wipe out with you if you're out and about. They sometimes contain emollients, lanolin and grease and things, because they're to cope with baby skins and to help your skin, but they will possibly stop your bag sticking. So nothing, really plain water's fine, should be fine.
Oh, we have a question in the chat for you as well, Carol, from Alison, saying, I'm just 3 weeks post-op and I'm just getting to grips with terms, etc. My stoma nurse is coming Monday to look at very sore skin under the pouch, unsure about convex idea. Are these secure? It seems as though they are more likely to pop off.
Well, other people can answer that for you, I should think. Particularly who's just said that they use
that was me,
convex. Anita.
Yeah.
Yes.
As I said, since I've been using the convex, they've been very secure, not had a single leak. They certainly don't pop off, and I go swimming a couple of times a week at least. So I would certainly recommend them. Yeah.
I would listen to your stoma nurse, who's asked me.
It's Justin. Hello.
Hi, Justin.
I've been using the convex bag for probably 5 years since I had this stoma created, and I also use a thin ring with it as there's a slight dip next to my stoma, and I have very few problems. Usually it's down to me not changing the bag or emptying it that I would get a leak or something. But yeah, it's usually user error rather than any particular problems with the convex, and it certainly suits me.
Yes, well, I think it has to be individual, doesn't it? If it works for you, that's really good. Can you see my screen yet? No. Okay.
See you.
Okay. Can you see me? That's good. I need to get out of this. Okay. Don't worry. I'll forget that. We'll just continue having our chat.
Alison has another question here, actually. Have you got any views on the use of Manuka Honey products? So I know some companies do use that as a bit of a USP, but is there any merit in the Manuka?
There are lots of additions to the adhesives these days. You've got vitamin E, aloe vera, all sorts. And the companies do a lot of research before they finally get to the end product. And so they will have been well tried. And you can usually ask the company for the results of the research, and they've usually got user satisfaction scores and things. Yeah, Manuka honey is very expensive, isn't it, if you want to buy it yourself to eat? But it's got amazing healing properties. But the actual hydrocolloid that the flanges are made of also has healing properties. It's used a lot in wound care for leg ulcers, say. So you often don't need an addition, but it's worth trying. I'm not going to advertise any one particular company, but there are lots of good bags out there. And as I say, they're always innovating with new things. And yes, people like the Manuka honey ones, some like the vitamin E ones, some don't need any extras. I don't think they're much more expensive because all the products have to sort of cost the same-ish. And if you like it, fine. It's really what works for you. And one of the things I wanted to say was that you really need to look at your skin every time you change your bag. Don't just assume it's fine. You need to look at it, because if you can see a problem starting and if you can catch it early, it's often easier to treat. So do take note of what's going on when you change your bag. These days, I was going on to say, these days, stoma nurses are using telemedicine more, in that you can photograph your stoma and email it into your stoma nurses, you know, if you can't get an appointment to see them. Alison, hello.
Hello. I just wanted
my partner in crime.
Oh, I missed you yesterday. What a pity you couldn't be there. And I hope your sore throat is improving.
My husband, guys, my husband has COVID, so I wasn't able to go to the AGM. Anyway.
Well, I just wanted to say two things. One, remember that when you go through the menopause, you will probably get skin changes, and these can affect the skin underneath your flange. And the other thing, mostly for the men, is if you've got a hirsute or lots of hair on your abdomen, that again can cause quite a few skin reactions, because you can be pulling out hairs every time you take the bag off. So these are just two areas that, you know, if you're aware of these things, you can maybe help to address them.
And if you want to shave your skin, we recommend an electric razor or a little beard trimmer head that won't cut the skin or cause any irritation.
Can I ask, Carol, I mean, when you have people speaking to you about skin conditions, is it more often due to leakage that's caused that problem? And is there a better routine people could be considering that would prevent the leakage, which ultimately causes the skin issues?
There are so many causes for leakage, aren't there? From consistency of the stool to the way the bag is applied to, is it the right bag for you? But certainly leakage causes a lot of the skin problems, because the stool coming out is actually very alkaline. People talk about it being acid and eating the skin. It's actually alkaline, but it still reacts with the skin to lift the surface of the skin, and the longer it's left, the more damage is caused. And that's another pointer I had in my presentation, that you need to change your bag at the first sign of leakage. Don't tape it up and hold on to the bag and leave it, because all the time that the stool is in contact with the skin, it's doing damage to it. So if you notice the slightest leak, please change your bag.
And are there other things people should do? I mean, there is so much on the market that they could do with pastes and powders and stuff. And obviously I'm not recommending any of them specifically, but some people maybe use too many things. Can you overuse stuff as well?
Well, you can sort of make a flat bag into a convex bag by adding a seal or some paste, but then you're using 2 or 3 things and you might as well use the convex bag. If you've got a dip, you need something to fill it, and there are pastes and seals and things that will do that, because you really need a flat surface for the stoma bag to stick to. It also needs to be dry, so make sure you dry your skin with an absorbent cloth, and we recommend kitchen roll. The wipes that you get with your bags are not very absorbent. They're made from the same material as nappy liners, so they're meant to allow fluid through them. So they don't actually dry very well. So good quality toilet paper or kitchen roll is a good way of drying your skin, or just leaving it open if your stoma is not very active. But not recommended.
Carol, I've noticed that now there seems to be on the market something that incorporates everything, from all the 3 things that you're likely to use all in one tube. What do you think of that?
Yes, I've seen adverts for those. I haven't compared prices, but if you're using those 3 products and you can get it in one, then why not? Anything to keep it simple and quick for you. Because you don't want to make changing a bag into a big thing. You don't want to take half an hour of, laying out all your bits and pieces and doing it sort of ultra carefully. I say do it carefully, but don't make it, don't concentrate on it. Don't make it a big thing in your life. Has anybody got any comments on that? Do they take a long time? Do you?
Well, I seem to take a long time because I use cohesive washers. I've got a dip and I have to sort that out, and that's why I sometimes get a leak, which is a patient fault rather than anything else. If I don't just get the cohesive washer right at the bottom, then I find I can have a small leak, but it is a small leak. And I soon know about it, so then I have to change it.
Do you use a mirror?
No. I don't know whether I don't know whether I could use a mirror and try and do it at the same time, but I could try.
There's been a comment in the chat box about from David saying that the seal works better once it's been warmed a little. I think that's the same for the bag as well. If you can put it under your arm or sort of on a radiator or hold it between your hands. Certainly seals and things, they do, if they're more pliable, they will fit into your dips much better.
And I noticed there's a comment from Alison. I appreciate, yes, it's all probably very new to you still at the moment. So yes, changing bags in the early days does seem a bit more of a faff because you're trying to remember what to put on, things you've got to put on before you put your bag on, etc., etc. But rest assured, it does get easier. You get into a rhythm. I had to have my bag change filmed a few years ago for a company that I'd agreed to do. And the guy who filmed it actually said to me, "My God, you did that quick. Last one I did was over half an hour. And mine was done in like a couple of minutes in one take." So it does just take time. And once you've got the system that works for you, you'll find it gets easier and quicker to do. And it doesn't become a faff.
Well, I change mine every 6 or 7 days. And you might think that's terribly unhygienic, but it lasts that long and it's comfortable. So when I change it, I make sure I do spend half an hour airing it, scrubbing it. I scrub around the stone with a massage sponge to get the circulation going on the sponge and thoroughly clean it, and try to air the skin a bit. I do it fairly soon after I wake up in the morning when there's not much coming through. So I can, and usually that works for half an hour. I can manage to do it. But everybody's different, but it doesn't rule my life then if I've got to. I think some people are told to change it every day. Maybe there are reasons for that, but pulling the bag on and off, I would have thought, was not the best idea. But you might disagree with that. I don't know.
Some people like to change their bag every day after their shower. And if you're careful with the way you take the bag off and use adhesive removers, if you'd like to, the bags are gentle to the skin, and it's not like ripping off a plaster or anything.
Okay.
So it's perfectly okay to change your bag every day if you want to. But you seem to have an amazing technique if you get your bag to last 6 days. And I'd probably say you're sort of adding up your 2 or 3 changes that we may have made in those days and doing it all at once. And if your skin is work, you've got an amazing outcome if you don't get leaks and you don't have any discomfort. So keep on. That's brilliant.
I'm envious.
In the olden days, when stone bags were first made, they were big, heavy old things with really sticky adhesives. The zinc oxide, do you remember the old white tape, and Caraya gum and things like that? And they were made to last, or people made them last a long time. But there were lots more skin problems then.
Is there anything in diet that affects our skin as well? Have you ever come across?
I'm going to throw them back at you because I'm sure you have.
I'm sure we should have asked Sophie Medal in that one earlier on.
Yeah, you can ask her later. Yes, people notice if they eat certain foods, it makes the output slightly different. But if you've got your skin protected, the output the stool shouldn't come in contact with the skin.
Yeah.
But you tell me what happens when you eat chili.
Well, yes, whatever you eat is going to affect your skin, isn't it?
You shouldn't get soreness if you've got protection and the bag is well stuck.
Yeah.
More if you've got a pouch, what you eat affects you, because obviously that's directly in contact with your skin. But, hopefully not too much for ileostomies.
Does anybody else in the room have any issues with regard to skin care? Have they had any issues, or maybe you've come up with a solution for something? No little hands are going up.
Got somebody saying after 28 years of only using toilet paper to wipe the skin on a bag change, he has no problems. So that's very economical.
Yeah. And Alison, I can see, yes, you've been told that you were doing it in the afternoon every day. And I will be honest, my bag change is actually evenings and mornings. And I know that sounds a lot, but I get an awful lot of gas and sometimes leaks overnight. So I change my bag in the morning, but then during the day, depending on my sport, I might get some kind of seepage. So it just depends. If I get a 24, 48 hours from a bag, for me, is actually good going. But I do change mine at least once a day. I use something to help remove it so it doesn't damage my skin. And I will say, touch wood, I've never had any skin issues whatsoever, and I've had mine 13 years. Joe, we have a hand up.
Yeah, just sort that out. Right. No, it's just the only comments I've had for having a stoma for 30 years now. I have had occasion. I do think I use a bag that's been around for almost as long, actually. A Hollister bag, which has got a very good filtration system, which is why I've stuck with it, which I use with the Hollister skin barrier and stuff. But I do think the old-fashioned way of picture framing the skin barrier using micropore, and I found differences at times with micropore tape from certain places. I get the impression the more expensive micropore, which will come with some of my prescription orders, doesn't cause a problem, but I've certainly at times when I've run out between orders and bought some cheaper stuff from chemists, I've had problems. I've had some skin reactions to that. That's caught me out time or two, and so much so that I've sorted the brand out and ordered some, and bought myself some off Amazon in bulk in the finish. So, but as a standby, but I think that's the one comment I got. The thing I'd be more interested about is knowing about is, since Caroline, you mentioned them and anybody else's experience, is flange extenders. I tried them once and I seem to think they were pretty good, but I've never tried them again. I probably should have done. And you mentioned silicone ones, and I haven't had this reaction with this occasional reaction with glues. I'll be tempted to give them a go again. And it's just more a case of knowing what's out there, really, is my issue. It's something I would have gone and probably sort of, if we'd been face to face today, I would have gone and discussed and got some more samples. I know. So, you know,
there are lots of them out there now, and there are some very thin ones too.
Yeah.
And I think it will be a case of trial and error, and you can ask for samples from companies.
Yeah.
If you need a list of companies, if you're a member of IA, in our journal, there'll be lots of adverts for different companies that you can contact.
I think it's finding the thinner ones, and it's just knowing who, you know, it is knowing what's there. It's knowing what's there. Because I say I haven't looked at flange extenders for quite some years, probably 4 or 5 years now, I should think. So yeah, but I do feel I ought to, because clearly they are much easier. It's going to be much easier than me sort of taping up with micropore tape all the time, and especially times we're only on holiday, you're trying to do quick changes. You don't want to spend all your time doing changes that. Admittedly, I know I can get a bag changed in 10 to 15 minutes quite comfortably. So I'd start to finish everything done. But it's something would be. It's I think for me, it's just an education thing of knowing what's out there. I think
you might find flange extenders more comfortable than micropore because they're designed for the job. But micropore is probably a bit more cost effective because it's not that expensive for a whole roll, but it's really up to you, but we wouldn't recommend using micropore to picture frame your stoma, because there are products there to do that. And as I say, all the major companies make them. And I expect if you just Googled flange extender, stoma flange extender, you'd get a whole lot of response.
Yeah.
You'll find on the main landing page for this event today, there are buttons to all of the, all the companies that are here supporting us today. And if you click on each of them, they will have Zoom rooms so you can actually speak to them. So if you wanted to, you could pop into any of them and have a chat with them if you wanted to ask any who are here at the event today. Yeah,
I should do. I did briefly hop in earlier during the coffee break, so yes, I'll have to go back and do that. But yeah.
That was good. If they're not there live, you can chat and leave a message and they'll get back to you.
But Caroline, it sounds like since you've had experience with these, it's the is it particularly worth looking for silicone-based ones?
For me personally, I found the silicone better simply because yes, they were thinner, but actually I didn't react to the material, whereas some of the adhesives I do react to. So for me, it was a choice because of the reaction to my skin. But I don't wear it in water because I don't find it stays on for my endurance for me. So it's got pros and cons for different products and how you use them.
Okay.
Yeah.
Right, thank you for that. Thank you.
You're welcome.
Again, it's what suits you. And again, we're very fortunate in this country that we can try and we can have what we want, more or less. You know, you have to be aware of cost and not waste things, but if you need it for your comfort and survival, then you should be able to get it.
Yeah.
Some areas now have formularies. They have a list of preferred products, and you may not initially be prescribed a particular product of your choice, but if you've tried the products that they want, they recommend, and they're not suitable, then you can go back and ask for what you want.
Well, I'm in Wales and I don't tend to have problems with prescriptions at all. So
Watch this space, it's being looked at.
We've got time for
Good.
one last question. I see Maureen's got her hand up, but we're nearly at 12:35.
Can I just say thank you very much? I've got to go, but thank
Oh,
you very
thank you.
much. Sorry.
Thank you, Anne. Maureen,
Yeah,
did you?
it's okay. It wasn't a question. It was just an observation that I remember when the flanges actually were incorporated into micropore, and they did. I was allergic to the micropore, so, and at that time it was difficult to get the flanges with the hydrocolloid, and it has been confirmed since then that I am actually allergic to micropore, so I have to be really careful. So I would never use that anyway. So it was just a comment.
Thank you.
Well, the older amongst us have got amazing memories of what bags used to be like, I'm sure. I mean, I've been stoma nursing for, 25 years, and there's been an immense change from start to finish of that period.
Yeah. Does anyone have any final questions or comments that they wanted to contribute?
I have to apologise that this wasn't actually the presentation and direction things were going in, but it's been really good that everybody's contributed and put your views forward, and maybe when I do this afternoon it'll work for me.
Yeah,
I do apologise.
That's no worries at all.
And I hope you're enjoying the day, and we'll see you back after lunch at 1:35
is the next.
1:35. Yeah, just keep my programme 1:35 for the pouch presentation, which I think you'll find interesting, even if you haven't got a pouch.
Thank you very much, Carol. Thank you
all.
for that talk. All right.
I know, I think you did more than me. Thank you for being here.